Good morning, good afternoon, good evening, everyone, whichever part of the world that you might be in. Thank you so much for joining us today, this morning. We are very, very excited for the discussion that is to follow. So I will be taking a very, very small moment, few couple of minutes to introduce the subject and introduce the topic, but then truly handing it over to our incredible panel and speakers for today. We are going to be discussing generative AI in healthcare today. And in fact, I think it's a very, very relevant time. It has been in the last 1 year. We've seen some phenomenal progress being made in this space. But explicitly in the last 1 month or so, we've had a number of conferences and events that have only highlighted how important and critical this field is becoming in all sectors, but specifically even within healthcare. We had the OpenAI Developer Conference here in San Francisco, which is where I am, earlier this week, in fact. We had the UK AI Summit not too long ago. As well, there is a Responsible AI Summit happening in New York, also very eminently. So needless to say, this is a topic that is, very much front and center for all of us. We also had the executive order being passed by the President of the United States earlier as well. So very relevant topic. And very excited to have everyone here, and specifically this panel. We are going to be covering a range of topics. And before we dive in, the one thing that we did want to share with everybody here is that we had an incredible amount of interest for this workshop specifically. And so we thought it would be fun to present for a few minutes, where all of our attendees, workshop attendees, are joining from, who they represent, and what they're most looking forward to in this space. So over to my wonderful colleagues, Louise and Whitney, who will be taking us through that a little bit.
Okay. Hi, everyone. I'm Louise from the Digital Transformations for Health Lab, and we're really pleased to be co-hosting this event with AI Future Lab during Digital Health Week. We've been DTH-Lab is working to implement the recommendations of the Lancet and Financial Times Commission to build stronger governance of digital technologies and data so that they can deliver better health outcomes for all people and respond to the needs of younger generations. So that's why our partnership with AI Future Lab and young experts from around the world is so important. So as you will know, when you registered for the event, we asked you a few questions, and this is to help set the scene for the event and give the panel a sense of who is in the audience today. So you'll see from this chart that we have people here from all parts of the world, showing that this is a topic that's of universal interest. And in the next slide, you'll see very briefly that we're also diverse in terms of our ages. We're really pleased that around half of the people who registered for this event are young people aged 18 to 30, which is what we were hoping for. And then finally, the last slide is we asked you, what are your thoughts about the role of generative AI in healthcare? We wanted to know whether you're feeling positive about the opportunities or slightly anxious about the potential risks. And you can see here that around half of the people who registered said that they're excited about the potential, they're optimistic about the role of generative AI in healthcare. Less than 10% said that they were worried about the negative consequences. So that leaves just under half of you who either weren't sure yet or felt both excited and anxious in equal measure. So it'll be interesting to see whether you feel the same way at the end of this session. And with that, I hand back over to you, Karishma.
Thank you. Thank you so much, Louise. So I think this is very representative of the fact that, we're basically seeing an incredible amount of interest in this space coming from world over, and we truly do appreciate the attendees making the time, depending on which part of the world you're in. This can be either super early in the morning or super late at night, so truly appreciate everybody taking the time. So I'm going to hand it over to the first speaker of today, who's going to introduce us to the world of generative AI, Akash. And Akash is a machine learning researcher at Stanford University. He has a background in biomedical engineering and computer science and was at Johns Hopkins previously. So he's built medical devices, and technology to help improve surgical outcomes. So really someone that has gone very, very deep in this space and leads a very exciting group of people here at Stanford that are very actively involved in the generative AI and just overall artificial intelligence space. So over to you, Akash.
Thank you so much, Krishma. And here, let me share my slides. Can everyone see this? Okay, amazing. Yeah, so hi, as I said, my name's Akash. I'm a machine learning researcher at Stanford in the departments of cardiothoracic surgery and computer science. And first of all, thank you for being here, and thank you to the DTH-Lab and the AI Future Lab for having me. I'm really excited to share what generative AI is and how I believe it will shape healthcare. And I call this future of healthcare with generative AI, healthcare 3.0. But maybe let's start with what I think healthcare 1.0 was. So I think around the time period, at least in the US, pre-2010, where there was little to no utilization of electronic health records, little to no utilization of AI. It was mostly humans, pens, and paper. And we were just making healthcare happen. So let's then flash to today where AI is being used in healthcare with the advent of electronic health records where you could digitize data and also advances in AI. We found that we could train models to do useful things. And I call this sort of traditional AI. And don't let the word traditional fool you. That's what's being used today. And it's currently in practice. And the goal here was to really offload specific tasks that a doctor does to an algorithm. And I think a key characteristic of this sort of traditional AI that is currently being used in clinic is it has a small output space. And let me explain a couple examples to really illustrate what I mean there. So if we look at a task such as detecting arrhythmias from ECG signals, we call this a binary classification task. An algorithm just outputs a 1 or a 0, 1 being the case that there is an arrhythmia in what it's seeing. We can also look at classifying chest X-ray pathology, for example, detecting pneumonia or tuberculosis from a chest X-ray. And this is the same sort of paradigm where the model outputs a really small value that gives you sort of prediction about something really narrow. And the last one I'll offer is basically classifying liver cancer from these histopathology slides. These are like slices of tissue. And an algorithm basically has to decide which amongst a few sort of predefined categories does this image fall into. So we can see that these are very specialized tasks, just one small piece of a decision that a doctor may have to make. And what we find is that these algorithms, oftentimes at these very narrow tasks, can sometimes outperform clinicians. And this can be helpful in decision making. It can help doctors, save time because it's less that they have to look through, and they can sort of automate some small piece of it. But then, let's look towards what generative AI is. The way I think of it is generative AI is all about creating content, creating text, creating images, creating videos, and really creating whatever you tell it to create, as long as you train it so. And what that gives us is an enormous output space. So rather than traditional AI where you're generating 1 or 2 values at a time, you can create reports, you can create documents, you can create new imaging modalities. So if you've ever used, ChatGPT or DALL-E, you probably have a good idea of what this is. And it really, what it unlocks is like essentially infinite possibilities. It can generate anything. And you just have to point it at the right things. And the main notion here is that we have open-ended tasks where rather than it being good at one small thing, you can really ask it to do more high-level things. And let's look at an example. So let's say we have a generative AI algorithm that's taking in, an X-ray. We have some echo coming from ultrasound, and we have some EHR data going into a generative AI algorithm. Rather than spitting out one value, you can ask it to create an assessment, and it will provide that assessment for you in natural language. You can also ask it to explain itself. Why does it think what it's saying in the assessment? And these algorithms can go even further and explain themselves further by saying, look, this is where in the input I believe this based on what I'm seeing. And sometimes there are new methods coming out where you can even predict into the future and say, okay, show me what this patient might look like 5, 10 years down the road, or with so-and-so treatment. And what we're seeing is that these generative AI algorithms are not just specialists in one small task, but they're rather generalists, and they can handle a wide variety of tasks that we really give to them. And so I'd like to just share what I think healthcare 3.0 will be with generative AI. So doctors do a really hard task. They have to consider lots of context. They have to consider a patient holistically, both the quantitative and qualitative side. And then they have to generate lots of outputs, actually. They have to generate reports. They have to generate diagnoses. And they have to ultimately come up with a treatment plan to help the patient. And so the role of traditional AI or narrow AI was to solve very specific problems that doctors had to do. If we can help automate one small piece of the decision making, it will probably help. And we find that this does certainly help, but it's 2023, and what we see in practice is that doctors are still overworked. They have a lot of work to do. Every day they have to sort of look at more and more context. And overall, this narrow AI, it's helpful, but it can have a somewhat limited impact. But let's look towards, where we'll probably be in a few years with healthcare 3.0. So generative AI can not just solve one task, but really augment a doctor with their entire workflows. It can do some of the more end-to-end work that doctors do. So it can help doctors process context. It can support them in more aspects than just one small defined area. And it can also help offload menial and simple tasks. I do want to note that it's important that with generative AI, we really are aware of the risks. Generative AI, because of its large output space, can be more useful for sure. But in turn, we will give it more responsibility, and that really creates a potential risk for greater harm to a patient. And it's also important to not just focus on the accuracy of the system, but really the bias within the system. Does it perform differently on different sorts of patients? And is it always consistent in the way it's behaving? AI has already been shown in traditional AI to exude bias. And we must consider that when we're developing generative AI, and make sure that we're robustly evaluating these systems before we use them to help doctors. And as a closing point, I want to emphasize that the goal here isn't to use generative AI to replace doctors. I mean, doctors are smart. They're like the most hardworking people and have decades of education. Rather, the goal is to support them in their work. We want to help offload menial tasks that aren't the best use of their time, and really help them make more informed decisions. And really, the final goal is just to enable doctors to focus on doing what they love and being great at it, which is improving patient lives. So yeah, thank you so much for listening. Thank you for being here. And yeah, I'd like to pass it off to the next speaker.
All right. So Akash, before we let you go, I guess I will ask you one question really quickly, super quickly. What is the application that you are the most excited about? As you mentioned, obviously there's a range of applications that, that people are already working on and that we expect to see in the next couple of years. But if there was one thing that you had to pick, especially given the institution you're at, I'd be very curious to understand, what are you most excited about?
Yeah, that's a good question. And it's almost hard to pick. There's so many problems in healthcare, and I think generative AI will really help in a lot of areas. I think one area that I particularly am very interested in is really helping doctors address a little bit of like the medical literacy gap sometimes that exists in patients. A part of a doctor's responsibility is to explain things to a patient, and patients coming from all different backgrounds. You may have patients that are PhDs in biology and they'll understand everything, or patients that are doctors. And, we certainly encounter patients that have little to no scientific working knowledge. Patients may not even be literate. And how do you explain something in a language to them that they can understand, so that they feel a part of the process, and they know what are the right things to do based on the treatment plan that the doctor's given? And I think generative AI will really help with that patient-facing side, and really not just figure out, what is the best way to speak to a patient, but really engage the patient more deeply than a doctor may have time for. And really that will result in better outcomes, because the patient will be more engaged. They'll be a part of the process, and they will not just have the top-down instructions from a doctor, but they will understand what the doctor is saying and realize the importance of what they're saying.
Yeah. Thank you. Thank you very much. All right. So I know there were a bunch of points that you touched in your talk that we will be diving into deeper. We have some speakers who are going to be talking about the ethics and the responsibility aspects of developing these models. I will hand it over to our next speaker, Lin Shin, who is the founder and CEO of Tech Connect, which is a AI-driven global social enterprise. Lin Shin is truly a rock star. She built her first healthcare product in her freshman year. She also has a background in biomedical engineering and applied math, and has been a part of numerous institutions spanning multiple countries, which include the US, China, and Japan. So over to you, Lin Shin, to walk us through your talk. Thank you.
Thank you so much for the kind introduction, and good morning, everyone. So I know Akash has touched a lot of points like on the generative AI. So for me, I'm going to be more focused on the venture scheme and the product perspective. So the reason why I'm diving into the AI for biohealth, because I have seen the potential and the application about the AI technologies in multiple verticals within the biohealth fields. So I want to stress that I know we're focused on the AI, generative AI today, but I also want to highlight that's part of the AI technologies, which focus on the content production, and many of the times has to be combined with other AI technologies, such as large language models and other data science, to actually drive the impact in the fields. So I also want to touch a little bit on the evolution. It all started from the chat box, which is also the most popular formats we're seeing today about the application of the generative AI. But I do also want to touch some of the recent advances. I know like ChatGPT has already launched the Turbo earlier this week. So there has been, like advances on the contextness and many of the newer kind of the voice regeneration. I think the name of the new product is Whisper, which I will touch later on, like how it will be very important and also have the transformative power on the mental health. And also it has a lower cost. So with that being said, Tech Connect is actually a venture studio. So the reason why I'm doing that, because I figure like under the each of the verticals, there can be synergy among the different, like the venture schemes. At the very beginning, we focus on the 3 different fields. So the first one would be the cell and gene therapy. Second would be the mental health. And the last would be on the climate monitoring biodiversity, meaning like we're using the biotech sequencing technologies to monitor the genetic mutations with a specific focus on the Fukushima release and also the Amazonian rivers. But today I will be majorly focused on the cell and gene therapy and also the mental health. So these two are kind of very different, like business models, I would say, because when we're talking about the real applications about the technology, it's not just about the tech perspective we're focused. It's also about the how we're going to make that, like down the ground. So for cell and gene therapy, it's mostly like more on the biotech bench, which is upstream in the whole innovations. So we know from the biotech, from the research and development, and down the road to the clinic trials, to the eventually we're going to touch on the patients. It's a very long cycle that can require a lot of the input and capitals and human capitals. So we focus on the cell and gene therapy, and we're looking at that. It's really like the 2B business model, meaning like on the research perspective, we're also looking at how the generative AI can also be combined with the LLM, which is not large language models. Starting from the data bootstrapping, so how it works is that we're looking at the cell as a basic unit. So from the very central dogma, we know like the DNA can be transcribed in the RNA, which eventually is going to translate into the proteins, which carry the basic functions of the cells. So how we're going to understand about the different, contexts about the genetic diseases, I think this is about how the mechanism can be elucidated through the generative AI. And on the business operations perspective, we're looking at the digitalization, which I think, like on the operation side about the sales prospecting, and also like how it's going to be automated with the backstop and instructions. It's always, it's also, like part of the process. So on the 2C side, which is focused on the mental health, right now we have a sub product, which is called the Mindset, which we witness the power of the generative AI, which is more focused on the minor ethnicity here in the US. So joining from the first-hand experience as a minor ethnicity in the US, there has been a huge gap into the mental health, meaning like every 136, Americans share one counselor. And about 33% of the Americans report they have the mental health diseases. However, many people don't have the access or immediate access to reach out the doctor when they are trying to reach out for the space, very safe space to vent. Hence, we are doing this one as more like the first-hand experience before they can reach out to the professional diagnosis, which I know the next speaker is also going to touch more on the psychiatry part. So I'm going to be more focused on the prior part, which is a counseling, coping strategy, and safe space to vent. So with that being said, we're leveraging the generative AI as a chat box to help with the language barrier. I know I have mentioned about the Whisper, which is really great because it's open sourced that can auto transcribe the different types of the languages. So right now we're focused on the Mandarin and Spanish. So hopefully also in the future with Arabic, but that one is a little bit sensitive and more complex given, like some of the other religion and cultural aspects. So from there, we're hoping to, provide also like the contents and coping strategies that are going to be more focused on the culture context. So with all these kind of the products, there's nevertheless, we're going to focus on the data connection and processing. So I know we're going to touch a little bit on the here in the US, I think it's a HIPAA. And also, by the way, FDA has proved the hundreds of the AI algorithm to evaluate how the mental health algorithm has been helping the patients. But I think in Europe, there's also has been GDPR. So once again, the different country with a different context and different cultures have a very different, way to approach this. But nevertheless, we're focused being the whole models that I think in the future will be more customized and personalizable based on the different religion and also region and the social expectation and also age. Because right now we're focused on, the international students here in the US, because that's also where the group of the ethnicity that we can most emphasize with. But other than that, we're also seeing a lot of the loneliness and also mental struggling from the seniors. Which is kind of the universal problem, because this is not just in the US, but also in the East Asia, which the society has entered, into the aging society. So with all these things, we're going to, have more different ways to collect the data. I mean, chatbox is one way, but survey and, doing all kinds of the testing is also another way. So I know we're also expecting another speaker to dive deeper into the whole complex arena, so I'm going to skip on that part. But this would be the whole idea about how the generative AI, at least the approach that I'm trying to explore to penetrate into the biohealth fields. With that being said, I will give the cord back to the moderator.
Thank you. So actually, before we let you go, also, going to just a really, really quick question. So in terms of, you mentioned that Tech Connect is a venture studio. I'd be curious to know, are these, broadly speaking, the three areas that you're focused on at the moment, or are there other new areas that you're seeing interest come in through? Because I know one part of it is just sifting through and figuring out which areas to focus on, because there are so many. And I think Akash mentioned that as well. There's so many applications.
Yeah, totally. I think there have been very different areas that we can focus on. And I think Akash has touched more on the medical part. So for me, the reason why I'm diving into all these fields is because I really want to enable the social impact, and also by leveraging the backgrounds and research training from the biomaterials and regenerative medicine. With that being said, I think I'm particularly sensitive about the cultural aspects, which is also part of my previous product experience when I'm dealing with medical data. Because when it comes to data curation, for instance, there can be a lot of biases. For example, when we're talking about the public health diseases, so when we're trying to do the automated pipeline about the data curation, normally they would just identify the African names or Black names into the public health diseases automatically market. So with that being said, I'm being particularly interested in how the AI can actually advance more on more sociable and also more equitable and more fair the AI algorithm, especially in the digital front, because there has been also a wide economic social gaps in these technologies. The seniors and also the youth, they are relatively most of the vulnerable communities. And there's a lot of, like seniors being left behind the technology field as well. So that's a reason why we're particularly interested in these fields about, like people who are being left behind in the digital era. So they can be the seniors, they can also be the people who don't have that accessibility to the technology, who are not that well versed in the, AI fields. So I think that's a general idea behind the Take Connect about why it is particular focus on these three fields. But for sure, I'm pretty sure there will be more exciting thing. I know Benchling has been also another, cell and gene therapy digitalization company, and there has been several other products as well that's already on the markets. So yeah, super excited to see how the peers are, synergize and push this field forward together.
Great, thank you so much. So I think some of the topics, Linshin, that you touched on in your presentation, specifically around mental health, is one that I know our next speaker is also going to be talking about. So without further ado, I'm going to hand it over to Rachna, Dr. Saralkar, as I call her. She is the medical product director at a startup called Deliberate AI, and specifically working in providing high quality mental care. She is sitting at the balance of patients, provider needs, and looking into kind of broader policy implications that can happen in mental health. So without further ado, we'll hand it over to you, Rachna.
Thank you. And I think I missed this. Do you want me to share my screen, or are you guys playing the, okay.
Yes.
All right, so this is pretty simple, not showing anything super fancy here, but thank you, Karishma and DTH-Lab again for having me here today. So I wanted to share this framework, and I wanted us to all think about together how we can use AI in healthcare. So on the x-axis, we have tasks that are easy versus hard for humans, and on the y-axis, easy versus hard for AI. So I'm going to talk through some examples as we walk through these quadrants. So easy for humans, hard for AI. This kind of top left is difficult territory, I think, right now. It's a simple risk-benefit analysis of whether the risk to humans with inadequately advanced technology right now is a benefit to the system. So there are many cases where it won't be, and I think you can think of things like driverless cars for medical transport, automating a hospital cafeteria. It's probably not worth it quite yet. So next, easy for humans, easy for AI. This is a really right place to start. Things we know that humans can do without tons of expertise required, but AI can do faster, cheaper, and likely better. So this is a quadrant that we've already seen huge leaps in industry, mental health, and healthcare at large. So at Deliberate, we've built a platform that allows for transcribing and summarization of clinical notes, similar to many companies in the healthcare space like Freed AI, Mental Inc., Naba Copilot, and even many academic institutions. So I've listed off a number of companies to basically point out that these and many more have already used generative AI to create tools that listen in on a clinician visit with a patient, and immediately after the session ends, provide an organized summary or note for the session. So I know our previous speakers have touched on this kind of operational improvement, but it's huge. It's huge that it's happening right now. This relieves hours of documentation time, especially in mental health, where the documentation can be really heavy. And it's a big factor in clinician burnout. And I'd say I see the impact multiplying every day as more clinicians and patients are educated about the generative AI that's backing the process. Trust is increasing, and we're completely transforming how documentation is done. It's very exciting. Now, hard for humans, easy for AI. This is a fun quadrant. These are tasks in healthcare where skill and expertise are required, but there's just not enough time in the day. So AI can inject an infinite pool of expert time into our system. So we've seen huge strides of this in the imaging world, like Akash talked about with automatic X-ray reads, rapid diagnostics, with other type of imaging. This quadrant is also where generative AI has been used to create chatbots, as Lingshin talked to us about and shared the amazing and incredibly work they're doing. So this is super exciting, but I want to slow down and talk about how generative AI, kind of some of its limitations, right? So it again doesn't have common sense reasoning. It doesn't understand true or false, right or wrong. It's not causally aware. It's predicting the next word based on patterns, not on any understanding of reality, which is why we not infrequently see misleading or incorrect outputs or what we call hallucinations sometimes. The other major limitation is this black box dilemma, something you guys have heard of probably, that these models can be opaque. We don't really understand how the base models or foundation models that things like ChatGPT were built on even work. And then those models like ChatGPT were fine-tuned by humans, which introduced even more bias to the models. As Akash mentioned earlier today, this means we don't know what kind of biases to watch out for and how those biases could be introduced into patient care. So despite this, there are many exciting use cases for chatbots built on generative AI, both patient and clinician facing. So I'd like to share a little bit about how we're using it to transform clinician education. In the late 1990s, an AI called Deep Blue was beating some of the greatest chess masters, and people feared that chess would disappear forever. But instead, the top of the chess world became much better, and people became grandmasters at a younger age because they were trained by AI. So like Akash was saying, many people worry that AI will completely replace doctors, when in reality, humans will really always need to be in the loop. And at Deliberate, we're working on providing a platform that allows different types of mental health clinicians to come to the same place and practice with real-time simulations of patients of different levels of complexity. Starting off as chatbots, these can eventually take on an avatar form. So I'm personally really excited about this, that mental health providers from diverse backgrounds, social workers, coaches, therapists, psychologists, psychiatrists, nurse practitioners, PAs, and more will have a way to improve their skills and test their progress. You can imagine this increases access to higher quality mental health care. So finally, we're in the last and upper right-hand quadrant, which I think is where the magic really happens. So these are tasks that are hard for humans and hard for AI. This is where AI can have a massive impact, potentially allowing providers to go beyond current human capabilities. Think personalized medicine. Which therapy or medicine works best for an individual patient? Or depression or anxiety monitoring at an individual level. Diagnostics and monitoring fall under this category, particularly in mental health, where you know that diagnosis and treatment are really riddled with subjectivity, and hard cases are tough for even the best clinicians. Now, you all know intuitively that people are not always incentivized to tell the truth, or don't feel safe or comfortable telling the truth about their feelings when it comes to issues like suicide, self-harm, substance use, or abuse. And when words alone are insufficient, we require additional data input. I know I certainly do when I can sense that a patient's words aren't really lining up with their facial or body expressions. So multimodal AI is the cornerstone of Deliberate's work, where we believe that combining different types of data, like wearable data with heart rate, O2 saturation, movement, facial expressions, vocal cues, combined with words, is necessary to create the powerful models that can do the tough work of this quadrant. So to kind of finish up, I want to remind everyone that generative AI is one piece of the puzzle. And we reviewed some of the limitations earlier in terms of data bias, lack of understanding, difficulty with interpretability. But another issue is that it requires significant computational resources, which can be expensive and environmentally costly. So most experts foresee a combination of the different kinds of AI, traditional AI that Akash talked about earlier, being used simultaneously. And as the technology continues to improve, one of the critical tasks we have in healthcare is to create really high quality, diverse multimodal data sets and make models that are explainable and that we understand enough of how they're made, trained, and tuned that clinicians feel confident making decisions based on the results. Thanks.
Thank you. Thank you so much. This was such a actually simple, like the framework, right? I think sometimes the more words we write, we complicate these concepts. But I think when you frame it this way in the context of having a quadrant to think about which problems we're solving, I think it makes it so much better. So thank you. All right. So with that, we will hand it over to our last speaker of today, who I think is going to be covering a topic that I think lots of people have questions about, the ethics and the responsibility that we exercise in terms of developing these algorithms. So Again, without further ado, I would like to hand it over to Professor Anurag Agrawal. He wears multiple hats, but at the moment he is the Dean of Biosciences and Health Research at the Trivedi School of Biosciences at Ashoka University. So please take us away, Professor Agrawal. Thank you.
Thank you very much, Karishma. And somebody, in a party has to be the party pooper. That's kind of my role for today. So we heard from, Akash earlier about healthcare 3.0, how that might look. We heard from Rachna regarding things that are hard for humans, it might be easy, and perhaps hard for AI, can be truly transformational. So let's talk a little bit about that. Next slide with me. So if I had to put everything in one cartoon, I would use this. Because we are speaking about health. It's not a typical consumer, it's a patient. And what they're looking for is simply being human, being empathetic, and being real. If I was to look at the quadrant we just saw, these are easy things for human beings. Perhaps they're hard for AI, perhaps they're simple. And in fact, we even had that warning sign right over there in the previous talk. But unfortunately, this is 90% of healthcare for you right there. The hard part about healthcare is a small fraction, precision medicine. A huge amount of healthcare is simply a human being who understands what you want out of the interaction and advice that is fit for purpose, not just correct, fit for purpose. And only a human being understands what the purpose is of an interaction. So how many ways can AI go wrong? Let's go to the next slide. The first, and I'm going to start in the middle of my slide simply because I need the previous one, the truthfulness and accuracy of a generative AI system is tricky. At one end, you can have hallucinations. Hallucinations are errors. They are simply based not on any data that was ever possibly fed into it. It is simply because of the way transformers work, the way attention works. Sometimes they hallucinate. But there's another huge problem. There can be fundamental bias within the data simply because all medical data, all medical practices contain the bias themselves. If you were to look at diagnosis of a woman having a heart attack versus a male, the reality is we have difficulty in female heart attacks because that's not how the textbooks have been written. So the entire data itself can be biased. Number two can be misinformation. Unlike many other things, there's plenty of misinformation floating around in health. And last, inequity in training data. If most of the data comes from only a few countries from few races, how do you expect any AI that comes out of it not to be biased? In fact, there's a very famous paper by Obermeyer in which they looked at how Black people versus white people, to get the same score that gives them extra care, Black people had to be sicker. It was not because the AI was biased against Black people. It's simply that poor people become sicker before they seek healthcare, and AIs can get confused because this very obvious logic of a human being doesn't apply to them. The other part that I'm terribly worried about at times is the intentional generation of content that is meant to be fake from day one, deep fakes. These things will occur in health as well, and this will be a problem. So how are we thinking about governance? It's a long, complicated topic, but I will suffice it to say two things. Number one, purpose limitation. And number two, identification. Already the new rules are going into place that says any generative content coming out, at least for the big tech actors, would have to have digital watermarks that allows it to be identified as a generated content, not something real. The other thing is going to be purpose limitation, whether it be about use of data, which we refer to in the commission and now in the Digital Transformation Lab as data solidarity. You cannot have the same rules for different people with different purposes. You can't have it for people with different credibility, different roles. You have to be aware of these risks and build governance structures accordingly. I'm going to stop here, and hopefully we're going to have more chats during the discussion.
Yes, absolutely. Thank you. So I think we do have actually a bunch of audience questions, and I think Professor Agrawal, actually you're leading us very well into the set of questions that I think most of our audience is asking about, which is largely around how do we build, first of all, how do we build trust amongst patients? But more importantly, I think some of the pieces that you mentioned around bias as well, you know, who ultimately is a governance authority on these algorithms that we're developing that are meant to treat a wide swath of patients, but then control is in the hands of such few people. So based on your experience, I think we have a lot of people in the audience who are very curious to know what work is actually happening to maybe democratize some of those aspects where, you know, we are giving culturally appropriate treatment. We're keeping those things in mind as we're developing these algorithms as well. So just curious from your perspective, what you've seen and what you're excited about there.
One thing that is occurring all over the world is the regulatory systems are country specific and will be increasingly so. And this comes from great experience that AI products built in one country do not equally work well in other countries. Even if you were to look at narrow AI, the tuberculosis and chest X-ray detection, which worked very well in Africa, built by a Netherlands team, failed miserably in Rawalpindi, Pakistan, because people in India and Pakistan with air pollution tend to have dirty lungs. So every government, I think today, with a clear digital policy, is creating its own data sets, which will be useful for regulatory purpose, and is building the architecture by which people can test and train their data without actually downloading the entire test on their own. That's one beginning. The other part is clearly on limitations on how much generative AI can be introduced. And number three, the responsibility of is still being kept with the physicians in terms of determination of what tools they can use. So for the time being, I think we are not at a point where autonomous AI systems will be allowed by any government. The closest we have seen now is a negative report on a chest X-ray, basically meaning normal, going straight to the patient in Europe with no human being having seen it. And that's based on very solid logic. In 125 possible features on a chest X-ray, 121 are better detected by AIs compared to human radiologists, and for 4 they're equal. So when an AI says there is nothing in the X-ray, there is probably nothing in the X-ray. And that's thinking as you regulate.
Of course. Great. I think that's wonderful to hear. So it's not all doom and gloom, because I think one of the things that often is easy to get caught up in is the fact that there's a lot of progress being made, but at the same time there's a lot that we need to work through, and some of this of course will be ongoing. There's not going to be, you know, a one size fits all model. But I think that did bring up another, I think, set of questions amongst our audience, and this is for any of the speakers that we had today, which is, and I think Professor Agrawal, you alluded to this briefly. You mentioned that, you know, countries are kind of coming up with their own policy and their own data sets and things like that. But in an increasingly globalized world and a mobile world where we are traveling across countries and continents and so on and so forth, do we think this data is going to be very, you know, centralized to a location, or is there actually going to be some sharing that happens? And this is truly for anyone, because I think everyone here has had experiences in multiple countries, but anyone can take that question.
Happy to let others jump in.
Yeah, I can chime in here. I think, I mean, my as you know, as someone who's like developing some of these models, I actually hope to have as diverse of a data set as possible. That's the algorithms, both from like a, you know, a theoretical perspective, but also just in practice, like a model will perform better if it's trained on a more diverse data set. It'll capture more of that like distribution in whether it's like patient population. I think the difficulty is actually in more of the logistics of organizing enough people to you know, convincing enough people to share their data, especially in healthcare data. You know, in the like industry, it's called like the moat. Like it's the thing that allows you to build something that others don't have. And I'm not a big fan of that, but I think we also need to be conscious of the, like, there's really important implications on the patient side, because with things like HIPAA like healthcare data is very sensitive. You're talking about like real lives here and real patient outcomes. And so naturally we don't want to just share that with everyone. But I personally am in really big favor of some sort of centralized system where, okay, if you're a physician and you're looking to work with these algorithms, or you're trying to train a generative AI system, I would love to be able to tap into data from other places to ensure that what I'm developing is like unbiased. I think it's really an operational and logistical challenge to get enough people on board. And what we're seeing is that, I mean, over the past like few decades since data has been digitized, it tends to be very siloed. I mean, excuse me, as a researcher at Stanford University, sometimes have trouble accessing other data sets within the same university. So I hope that it will become more like interoperable and more sort of centralized like data sharing. I think it's something that will take some time and a lot of like critical thinking to ensure that we strike the right balance of being openly sharing our data to train the best possible models, but also not sacrificing patient privacy.
Right. And I think, Vincent, you had a comment to add, I think, as well. Please go ahead.
Yes, I love that idea. And I echo to Akash's point about, having the diverse data sets, which is also something like we're struggling about. And I also noticed like some audience mentioned about federated learning, which is truly like quite a good way to resolve the data sharing problems. However, the problems that we're seeing today, I think Akash touched, from the sort of like the data rights, right? Who own the data, like how the patients feel comfortable about sharing their data. That would be one way to look at it. I think there's another way to look at it, which is like between the different nations or international like collaboration. I know, Karishma, you touched on like how we're becoming a more globalization and people travel and mobilize more freely. To be honest, I would challenge you on that point of view, because I figure, with the rising of the nationalism, there's actually kind of a reverse on the globalization, especially on the data. For me, I would like to touch from the business perspective, because, like, for example, I'm originally from mainland China, and I'm starting this Connect Studio, which focuses on the AI-driven biohealth. Something I have to sign on the business paper is about technology control. So it's really about import and export, about all this data, and whether it's, like highly technology alertive or sensitive. So I think many of the challenges not coming from the tech perspective. I know federated learning can be some way, to circumvent the circumstances, but I think the major or critical factors behind is actually still come from the human part. So having the different stakeholder from the different country represented different voices, and from, like the healthcare side, medical doctor side, patient side, and even including the policy side and the business, product manager side, or like different stakeholders, even have them to sit down would be a huge, huge challenge. Like they don't even need to talk about anything. Just to gather these people, just sit down at one table and talk about AI, I think it's going to be very challenging. With that being said, there are still some hopeful, data sharing. For example, during the COVID time, I think this is where the healthcare, like climate change, can be the unifying forces that gather people all together to, work together. However, even during the global pandemic, which is supposed to be the most convenient scenario situation for people to collaborate on the healthcare and for the data sharing, instead, what we're seeing is like people are fighting against on the vaccination, rights, or for the resources and the materials and the data, and people doubt each other. So that is kind of frustrating to say. However, with that being said, I also noticed, like the rising areas or regions. I think especially today, we should look at, country by country and region by region side, instead of like looking at the global as a whole. I mean, indeed, US, China, and even UK, recently they're having another high level like AI governors conferences and, meetings to come with some of the common senses. But I think if you look beyond that, when we're talking about the diverse data sets, if we're looking at the rising power of the South Asia, about South America, and also from the Africa especially. I think Africa particularly has been putting a lot of efforts on the genetic information, and they are welcoming the cutting edge technologies from the Europe, from North America, even from China, to go to that area using their technology to do the sequencing and, like decipher many of the diseases over there. And I think this might be actually a good model when we're talking about the data synergy and also having the diverse data sets. So I think this is another angle, which is the reason why I figure private sector actually has more potential and opportunities when it comes to gathering, diverse data sets. It's not coming from the governor's side. I think it's really like the private sector, like Hugging Face, for example, and even including this time, with the TikTok, we're seeing the democratization of the information. So I think it's really versus, like the centralized system to unite all these data sources. I think private sector, when we're doing the right, when they're respecting the patient's, privacy, when they're doing the proper regulatory, compliance, they have bigger chance to drive forward about how data is going to be used and also, be respected and also regulated in the future. So that's just some of the personal observation here.
All right. And I think Dr. Agrawal had a comment there as well. So please go ahead.
A very brief comment. One is, data privacy is often given as a reason for not sharing data. But the reality is that that is not always the real reason for not sharing data. It is the dominance of the market and the creation of the product and the volume and the value, system generation of the IP. Those are real reasons. And until we figure out how to share the benefits well, I think data sharing would not be solved simply by technological solutions like federated learning. I actually agree a lot that nationalism is possibly on the rise as opposed to easy sharing of data. And for good reasons. I would also point out a lot of these regulatory things we are doing for deepfakes, etc., will apply to big tech. And big tech will comply. It's the state actors that we need to continue to worry about.
Yep. That is very accurate. So I do have one final question, actually, and I will give this to Rachna because I think it's very relevant to the work that you're doing, and then we want to make sure we have some time for some closing thoughts as well. So I think there were a lot of questions that we had around, how do we bring a less tech-skilled clinical workforce into the development of these algorithms, and how might health workers go about integrating AI into their workflows? So I think, Rachna, maybe you're really well poised to answer this question, since I imagine you are already encountering this to some degree. So would be very curious to hear your thoughts.
Yeah, absolutely. I just wanted to add really quickly to the last question that, we're what some of the work we're doing right now is collecting audio video data, and to just agree with my panelists, patients are okay with providing it, even video data. It's providers, it's the companies that's where we hit it. Patients want to get better. Patients want technology to help them. Just that little added. So I think there were two parts to your question. One was how can kind of diverse healthcare workforce improve their skills through AI? Is that correct? Is that correct?
Yeah, like integrating the inevitable, which is likely to happen. So yeah. How can they become more partners? And then specifically, I think for a clinical workforce that might be less tech skilled, how do they stop fearing this, but rather think of it more as an ally?
Yeah, no, I think these are great questions. And I think it's okay that this is going to take some time. I think that's the first step. I think that, Dr. Agrawal talked about trust, and trust is real here, and trust does not happen overnight. And that's okay. While we can sit here as panelists and say, this is definitely the future and everything's going to be different in 5-10 years, and that may very well be true. It is okay for people from different generations, different walks of life to take their time to understand what they're getting into. Because as much as you may, for example, use one of the workflow tools that I talked about earlier in my talk, you can jump on and try it out today if you want it for free. It's very easy, but you have every right to be concerned about what does encryption mean? How safe is that really? And to ask those questions and to come to these panels and to try it out slowly and kind of develop that on your own. I think that when you're part of an institution, making sure that these conversations are happening in your institution is really important. Asking for talks to be had, asking for, lunches or dinners to be organized so that the group together is being educated and you're making kind of informed decisions about, well, how do we start stepping into this water? And I think working with operational work, improving workflow is probably an easier way to step into it than anything kind of patient facing. And also education, I think, is also the other way that I think, some of the tools that we talked about at Deliberate, I think those are both easier ways to kind of fathom, okay, well, this is not directly patient facing. These are ways that I, as a healthcare worker, improve my life, improve both my skill and improve my quality of life by decreasing the hours I spend doing documentation, or there's lots of other workflow tools out there using generative AI. I think that's a really much more comfortable place to start, and I think people will be surprised as you go through that. It'll get easier.
Thank you. I know we're very close to time, and perhaps we'll go over just by a minute or two, but Jules, if you can please share that illustration one more time with all of us here. So Jules, our lovely illustrator who kindly volunteered to help us out this evening to capture the main thoughts coming out of this discussion. Thank you so much. It looks so beautiful. And I think some folks have asked for it. We will certainly share it along with the recording to this session, but really wanted to thank you so much for taking out the time and keeping up. I feel like this is a topic where we can go on for a couple of hours, and specifically, I think we all have a lot of thoughts about it. So with that, I will hand it over to Jade, who has been my co-collaborator as well on this, to maybe help close things out for us today. But thank you everyone for joining, and Jade, handing it over to you to help close this out for us.
Thank you, Karishma. Wow, today was really exciting. As you said, I feel like we could spend another half hour minimum just talking through some of these ideas. I am side-eyeing Louise and Whitney and Nicole. I don't know if we have time to, because I saw some of the questions on the Mentimeter that are so relevant, and it's just clearly, guys, we should do a part 2 just to answer some of these questions. But I maybe wanting just to ask if we could quickly, just anyone from the audience, just share maybe 1 or 2 thoughts or just takeaways from today's session. I think if we could just end with that, and then we'll just wrap up with sharing some of the information to how to connect with all of us after. So just anyone, just inviting our 60+ audience members, just anyone who would like to share. Doing all the rush, God. Okay, if you Philip has his hand up, please feel free, just briefly, Philip, as we wrap, to just share.
I think we have someone who's raised their hand, actually. I think Philip, if I'm seeing it correctly. Philip, go ahead, please. And Philip, if you're saying something, we cannot hear you.
Philip might be having some tech difficulties. Alrighty, well, I'm seeing some great feedback in the chat. Thanks a lot. Everyone's remarks has been, it's been a great session. Louisa, Whitney, if you just want to share the screen for the last couple slides you had of the Mentimeter poll. Amazing. So if you guys just want to pop any more questions in there, I guess internally we'll kind of figure out how to incorporate them maybe into a future session, or maybe just ask our wonderful panelists maybe to answer a couple of them in our post workshop publications. So feel free to continue. I think we'll probably keep that open for a few more hours. This is a QR code that has a link tree that has some information about everyone that you would have met today. So the Digital Transformations for Health Lab, the AI Future Lab, and our wonderful panelists if you want to connect with us offline. So feel free to snap that. We'll also share. And there's some workings of a part 2. So if you guys found today's session pretty exciting, want to learn more, attend some more of our sessions, please feel free to sign up here, and we'll keep you up to date about future sessions. Let's see, Louise. Yeah, okay, so Louise from the DTH-Lab has also just shared that same link in the group chat. So I see one hand. I don't know what time is it, 12:04. Leah, you have 30 seconds to share. Go.
Oh, we heard you for a quick second, but then on mute again.
Yeah.
But yes. I think.
Can you hear me now? Okay.
Yes.
Yeah, you're good, Leah.
Yeah, thank you for a very insightful section. I truly am impacted by being part of the section. I've always been very skeptical about AI for mental health, and we recently had a discussion around that with an organization that wanted to work with us, and I totally wrote it off. But from this section, I can see that it's a possibility. AI can totally be used for health. Thank you for a very wonderful session. Bye.
Thank you, Leah, for sharing. And just to echo Dr. Sarasa's comment, I think it really struck with me, like the idea of just building trust around all of this. It will take time, and I think as we do more sessions like this and understand that just demystifying the topic, I think more and more we'll see just the actual positive potential for AI in healthcare. Okay, I see Prof has to leave, and then I think we just have one more hand. So Mathilde, if you would like to share this very quickly as well in a few seconds.
Yes, I just wanted to say thank you so much to the DTH-Lab. I think it's interesting, and I managed to listen for the. Also, just to say, look at the Digital Health Week website. There's many other events happening during this Global Week of Action. Take a look at the action tracker. Yeah, tune into other events that are also happening this week. Thank you so much.
Please pop it in the chat for everyone, the link to the calendar before we hop off. So with that, just thank you so much. I think all of us in this room really feel the love. It's been a labor of love for all of us, and we're just so happy to see. I know Krishma, Whitney, Louise, Mario, we're all excited and really happy that this came out so well. And just thank you for just being such an incredible audience, and just make sure and connect with us. And yeah, anything else from my team members before we just close today?
No, I was just going to give a big shout out to Luis and Whitney, both of whom are true troopers and true allies in this journey. As Jade, you mentioned, it's been a labor of love. So thank you so much. Thank you both so much for your support.
And thank you, Jules. We love the illustration.
Yes.
Thank you, everyone.
Have a great day, everyone. Please stay connected. Bye.
Amazing work.